my name is Lindsay Smith. This is my head to toe assessment for spring semester 2026, NURS 7643. Today is January 23rd, 2026. And I'm going to scan the room. These are my supplies. And the floor. And the ceiling. Okay. Okay. So I would start by introducing myself, doing hand hygiene, getting consent, and then putting them in a gown. But for the sake of the assessment, we're going to do a gown. And during the entire part of the assessment, I'm going to be assessing the skin. I'm going to be looking at color, texture, turgor, moisture, edema, checking for any type of lesions, scarring, bruising, or nevi. I'm going to start by assessing the face and the head. I'm looking at size, shape, contour, assessing for midline and symmetry. I'm going to assess the top of the head, palpating, and I'm checking for hair color, texture, distribution. I'm palpating for any type of tenderness, masses, depressions, lesions, and I'm looking for any infestations. I am going to now palpate the temporal arteries for any tenderness. Great. I'm going to palpate lymph nodes. So we have preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Great. I'm going to assess cranial nerve number 5. I'm testing for motor, so go ahead and clench your jaw. Good. And then cranial nerve number 5, sensory. So I'm going to have you close your eyes and just let me know where I'm touching.
Forehead, cheek, nose, cheek, chin.
Great. Also this time I'm going to check for TMJ, so I'm just going to have you open and close your jaw. Good. I'm checking for any tenderness, crepitus, or subluxation. Now I'm going to move on to the ears. Again, I'm assessing for symmetry. I'm assessing the outer ear, looking for size, shape. I'm going to palpate the pinna and the tragus for any masses. Then I'm going to assess I'm assessing the outer ear by looking at it, and then the inner ear, and I'm going to look at that tympanic membrane. And I'm checking for color, and if there's any drainage or bulging, and the cone of light. Okay. We're also going to test hearing, cranial nerve number 8. So I'm going to have you cover one ear, and I'm going to whisper, and just let me know what you hear.
ABC.
All right, and the other side.
1, 2, 3.
Great. We're going to do the Weber test. So I'm going to put this on top of your head. Just let me know if you hear it on both sides.
I do.
Okay. And then I'm going to test, do the Renee. So just let me know if you hear it when you stop hearing it, both on the bone and then in front of your ear.
Okay. Okay.
Okay, and now we're going to do the other side.
Okay. Okay.
Okay, and so air conduction is greater than bone conduction. Gonna move on to the nose. I'm going to have you let me know. This is cranial nerve number 1. Tell me what you smell.
Alcohol.
Okay, great. And then I'm assessing it for midline. I'm gonna have you I'm gonna test for patency. So I'm gonna close one nostril and blow out. Close one nostril, blow out. We're also gonna go back to the eyes. I'm gonna assess the eyebrows, eyelashes, palpebral fissures. I'm gonna take off your glasses for me. I am gonna assess, open up, the sclera and the conjunctiva. I'm looking for any redness, drainage, or lesions. We're gonna first test cranial nerve number 2. You can put your glasses back on. This is for visual acuity and peripheral. So I'm gonna have you cover one eye and just read the lowest that you can read.
CFDHJ.
And cover your other eye and read the lowest.
CFDHJ.
And then cover both and read the lowest you can read.
LTFPH.
Okay, great. So that's 20/20 with glasses on and both eyes open. So now we're going to look at cranial nerve number 3. I'm going to assess pupillary constriction reaction, both direct and conjugate. So take the glasses off for me. And just look straight ahead. I'm going to shine a bright light in your eye. Good. Good. And then one more time. Good. Testing both direct and conjugate. While your glasses are off, I'm going to go ahead and take a look at the internal structures of your eye, checking for that red reflex, and then again looking at those internal structures. So just look straight ahead. Ideally, this would be in a darkened room. Great. Great. All right, and you can put your glasses back on. Assessing, going back to cranial nerve number 2, we're going to look at peripheral vision. So just look straight ahead at me and let me know what number I'm holding up.
1, 2, 1, 2.
Great. And we're going to assess cranial nerve number 3, 4, and 6. And so I'm going to have you just look straight ahead and follow my finger. Great. Great. And then cranial nerve number 3, we're looking for that accommodation and conjugate gaze, so just follow my finger as it comes in. Great. Okay, and so now we're going to move on to the mouth. So I am going to be assessing the lips, the gums, the teeth, the tongue, the buccal mucosa, the palate and the uvula, so the roof of the mouth, the posterior nasopharynx and tonsils if they're present, and then under the tongue, the floor of the mouth. We're going to test cranial nerves number 9 and 10, so I'm going to have you stick out your tongue and say ah for me.
Ah.
Good, and I'm looking for that soft palate and that uvula to rise symmetrically with phonation. And then stick out your tongue for me. Good, and that's assessing cranial nerve number 12. Tongue is midline without fasciculation. Moving on to the neck, I'm going to assess the trachea, make sure that it's midline, palpate that. Again, as I'm moving on to the neck, I'm assessing the skin for color, texture, turgor, moisture, edema, any lesions, nevi, bruising, scarring. I'm going to go behind you and we're going to palpate the thyroid, so go ahead and swallow for me. And swallow for me. Great. I'm going to assess the carotid arteries. Great. Great. And then I'm going to just listen over them for bruise with the bell of my stethoscope. Great. And then we're going to test cranial nerve number 11. I want to have you shrug your shoulders. Great. And then we're going to do range of motion of the neck. So I'm going to have you flex, extend, hyperextend, lateral flexion, and rotation. Great. So now I'm going to have you stand up. I'm going to turn this sideways as we're going to move to the posterior chest. There you go. Sit back down.
Okay. Like this?
Yep. So now we're going to move on to the posterior chest. During the respiratory assessment, again, ideally his shirt would be off and I'd be assessing the skin as well. I'm also going to assess for any signs of respiratory distress. So I'm looking for accessory muscle use, tripod breathing, pursed lip breathing, retractions, and any dyspnea or cyanosis. So first, just take some breaths for me. I'm just going to palpate for symmetrical expansion. I'm also inspecting and looking for that symmetrical expansion. I'm going to palpate for tactile fremitus. So as I go down, just say 99.
99, 99, 99, 99, 99.
Yeah, great. I'm now going to percuss in the intercostal spaces. All right, and now I'm going to just listen over the lung fields. Deep breath for me. And you can just breathe normally. Breathe. Breathe. Great. Great. Now I'm going to test for egophony. So as I go down, I just want you to say E.
E, 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 E.
And then as I go, now we're going to do bronchophony. So as I go down, I just want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great. And then last time we're going to do whisper pectriloquy. So as I go down, I just want you to whisper 1, 2, 3. Great. And so now I'm going to kind of turn you back around. I'm going to do anterior chest. There you go. Okay. So now moving to anterior chest. Again, I'm just inspecting for that symmetrical rise and fall. I'm going to inspect for tactile fremitus. So say 99.
99, 99, 99, 99.
And then I'm just palpating for symmetrical respiration, so just breathe for me. Okay, and now I'm gonna listen anteriorly. So just breathe regular. Breathe. Great. So now we're going to move on to the cardiac assessment. I'm going to listen to all lung fields, both with the diaphragm and then the belt of my stethoscope. So second intercostal space, left sternal border, we've got the aortic. Second intercostal space, right sternal border, we've got the pulmonic. Third intercostal space, left sternal border, we've got Erb's point. Third intercostal space, left sternal border, we've got the tricuspid, and then fifth intercostal space, mid-clavicular line, we've got mitral. All right, and then we'll go back through with the bell. So aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to palpate the PMI, which is fifth intercostal space, left sternal border, and then I'm going to listen to that. I would listen for a full minute, but for sake of time, great. And then I'd listen for a full minute to get that full apical pulse. So now I'm going to have you lie down. Great. And so as he's lying down, I'm going to be assessing for any heaves or lifts in the cardiac space. I'm going to palpate each spot for any thrills. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'm just going to repeat my cardiac exam in those spots. So aortic, pulmonic, Erb's point, tricuspid, mitral, back around, aortic, pulmonic, Erb's point, tricuspid, and then mitral. And also, as he's laying down, ideally at like a 30 to 45 degree angle, I'd be assessing for any jugular venous distension. So now I'm going to move on to the abdomen. I'm going to be assessing the abdomen. I'm looking for normal contours, checking for any masses or bulges. I'm going to start with an auscultation of the arteries for any bruits. So we've got aortic, renal, iliac, and then femoral. I'm now going to assess all 4 quadrants for bowel sounds. I'm going to percuss all 4 quadrants, checking for any tympany, dullness. And now I'm going to palpate each quadrant, just palpating for any tenderness or masses. Great, and I'm going to palpate, or attempt to palpate the liver, and then the spleen. So that's deep palpation here, and then over here, which they are not palpable. And so you go ahead and sit back up for me, please. Now I'm going to check for CVA tenderness on the right and on the left. Okay, you can stand back up. We're gonna turn you around. And again, as I was assessing the abdomen, I'm going to be assessing the skin as well throughout all parts of the assessment. So now we're going to move to the upper extremities. As I'm going through all the joints, I'm going to be palpating all the joints for any tenderness, assessing them for crepitus, redness, tenderness, any deformities, and assessing for symmetry. I'm also going to be assessing the upper limbs. I'm looking at color, temperature, any edema. So let me see your hands. I'm going to start with capillary refill of the fingers. Great. I'm going to check for radial pulse. Good. We're going to do a range of motion. So you're going to flex, extend, hyperextend, and then abduct, adduct. Great. And squeeze my hands. Good. Checking grip strength. Now we're going to do the wrist. And so you're going to, again, I'm checking each joint, palpating for tenderness or any deformities, swelling, tenderness. And so we're going to flex, extend, hyperextend, ulnar deviation, so the pinky side, radial deviation, and circumflexion, so rotation. Great. Now we're going to do elbows. So we're going to flex, extend, hyperextend. Good. We're going to check strength. So I want you to pull back against me, whoop, and push against me. Great. Now we're going to check the shoulder girdle. And so we're going to flex, extend, hyperextend, abduct away, adduct towards. We're going to do external rotation and then internal rotation. Great. And then rotation. Great. And then I'm going to have you push against me and pull against me. Great. We're going to also now check sensation of the upper and the lower extremities. And so just close your eyes and let me know where I'm touching.
Elbow.
Just say like left arm, right arm.
No, left arm. Left leg. Right arm. Right leg.
Perfect. We're also going to check for cerebellar function. And so put your hands on your knees and kind of flip-flop them over. Go back and forth. And then part of the finger range of motion as well is you're going to take your thumb and fingers together, back and forth. Perfect. Now I want you to touch your nose and then touch my finger. Keep going. Great. We're going to test now for stereognosis, and so I'm going to have you close your eyes. I'm going to put an item in your hand, and I just want you to tell me what it is. So what is that?
It's a car.
Great. And then your other hand, can you tell me what that is?
Battery.
Perfect. Keep your eyes closed. I'm now going to write a letter. This is graphesthesia, and I just want you to let me know what I'm writing.
C.
Great.
A.
Perfect. You can open your eyes now. We're going to check for deep tendon reflex. So the first is the brachioradialis. Great. This side. Great. And now bicep. Good. Good. And then you can just relax your arm. Tricep. Wait, one more time. There we go. Tricep, relax your arm. Here we go. And then relax and dangle your legs. So we're going to do patellar, Achilles. One more time. And then Achilles. And then Babinski's. So just relax your leg. Good. Good. Okay. So now we're going to move to the lower extremities. So starting with the toes. Again, as I'm assessing the lower extremities, I'm assessing for color, texture, temperature, looking for any edema, and still assessing the skin. So with toes, capillary refill. Great. Great. I'm going to do the dorsalis pedis and posterior tibialis pulses. We're also going to check for a vibratory sensation on the medial malleolus and the ulnar. So just let me know if you feel sensation. So close your eyes, hold your hand out. Let me know if you feel vibration. Another hand.
Yes. Yep. Yep.
Perfect. Okay, and so back to toes. So we're going to flex our toes, so kind of squeeze them down, extend, hyperextend up, good. Abduct, so spread them out, adduct, put them together. Great, now we're doing ankle, assessing the ankles, again, palpating for tenderness. We're going to plantar flex, plantar flex, dorsiflex, inversion, so turn them in, eversion, turn them out, and then rotate them around. Great, and then I want you to push down on my hands like you're driving a car. Perfect. Going up to the knees, again, I'm assessing the knee joints. I'm going to have you push against my hands. Good. Pull against my hands. Perfect. And then hips, I'm going to, again, assessing the hip joints. Go ahead and push against my hands and pull against my hands. Great. You go ahead and stand on that. Okay. So now we're going to check range of motion of the knee. So we're going to flex, extend, hyperextend. Other side, flex, extend, hyperextend. Perfect. And then hip, we're going to flex, extend, hyperextend, and then flex, extend, hyperextend. We're going to adduct away from the body. Other side. Adduct towards the body. Good. Good. We're going to external rotate. Good. Other side. Internal rotate. Good. Other side. And then rotate around. Good. Perfect. So now I'm going to assess the spine. So I'm going to turn around for me. I'm looking at spinal curvature, checking for, again, symmetry, any abnormality in curvature. Go ahead and bend over for me. Checking the curvature of the spine for any scoliosis. You can stand back up, turn back around. We're going to flex, extend, hyperextend, lateral flexion, or both sides, and then rotation. All right, we're gonna do the Romberg test, so go ahead and close your eyes, hands out for me. Good, and then back up just a few steps. You can open your eyes now. I just want you to walk normally forward for me. And then turn around, and I want you to walk heel to toe back. Perfect. And then turn around and hop on one foot for me. Okay, perfect. And that concludes my head to toe.